Thank you, sir, and thank you, Dr. Sujit, for giving me this opportunity. So once you have known the machine, you have made the incision, you have done the capsule excision, hydrodissection. Now it's the time to manage the nucleus. So nucleotomy is the fundamental step of the phacoemulsification. Why it is fundamental? Because you are removing a nucleus which is 8 to 9 millimeter in diameter through 5.5 or 5 millimeter of capsular axis and through 2.2 millimeter incision. So this is very important step of phacoemulsification. And the essence of the nucleotomy is to remove the central core of the nucleus. And this is done with the help of the technology and techniques. So technology, you have just heard about the machine. So what are the techniques which can be applied to remove the nucleus? This is generally, everybody has their own way of removing the nucleus, or basically, essentially you can say that it is removed in 3 ways: divide and conquer technique, direct chop, and stop and chop. And so for soft captured, you have different techniques. So actually, when you start, this course is basically a basic course, so just wanted to put some slide. If you are starting your journey as a phaco surgeon, you must attend. Nowadays, we have a lot of SSTC courses in AIS also, and even state level courses, conferences. So you must attend that, so you could know how to coordinate the foot pedal, your hand, your eye, your foot, and everything. And everybody has to go through transition phase. When you are a very young surgeon, you have access to very basic machine. This is my journey actually. Started with a very basic machine, but now I own Centurion. But the irony is that when you are learning, when you are a very novice surgeon, you have the very basic machine with lot of deficiency in that. But everyone has to learn, and by modulating the machine, you can actually become a accomplished phaco surgeon even with the basic machines. So there are various settings which Dr. Sujit has already told, but while you are just saving the nucleus, you should understand that you don't require a lot of vacuum here because you don't want to hold the nucleus. So most important is the power, because you are cutting the nucleus, so keep the flow rate low, vacuum low, and use high power. For chopping, you want to hold the nucleus, so here you want to increase the vacuum level, which will facilitate for holding and then chopping. You need to have very good followability, so you will keep the flow rate high. Ideal case for any beginner should be grade 2 nucleus, prominent eyeball, cooperative patient, properly constructed wound, and properly done capsular axis. Phaco tip has already been told for a beginner, or I think 45 degrees is a combination where it gives good hold at the same time good cutting also. So the essential part of any phaco steps like for quadrant or chop, anything is trenching. That is making groove in the center of the nucleus. For that, you actually just keep the parameter with low flow, low vacuum, but high energy. This is small video clip. You see that hydrodissection is being done here. And before managing the nucleus, you ensure that the nucleus is rotating freely. Until it rotates, you don't do that as a beginner. Always try to rotate the nucleus completely so that you can ensure that the fluid is freely coming through the 2 side ports of the sleeve of the phaco tip. And once you enter, you just remove the superficial cortex to expose the harder part of the nucleus. Then only you can start doing the sculpting of the nucleus. Start from the proximal end of the edge of the capsule axis inside it. Then move forward, putting the foot switch position in 3. Gradually go forward without pushing the nucleus gently. And when you are coming back, come to foot switch position 1, because you want just irrigation there to remain the chamber formed. And you can do it in 3 or 4 times to have a better depth of the center core of the nucleus. Ideally, it should be at least 2 width wider than the tip of the handpiece, or depth should be around 3 tip diameter. Divide and conquer technique is one of the basic steps, and I think that all the basic surgeon or initial surgeons should adopt these techniques, because the advantage is that whatever you are doing in a very controlled manner under direct visualization. There is no vacuum is very low, so there is no turbulence in the anterior chamber, and whatever you do, you just see it and do it, and it is done in a very gradual and smooth manner, and though it takes time, but it is very essential to have some confidence. It can be used in all grade of nucleus, not even in the soft, but not even in the very hard, but also in the soft cataract also. And it is very easier to learn also. So here you have to keep the low flow rate and low vacuum, but higher power. But disadvantage is that it requires more energy and more time. So coming to how you divide the nucleus. Once you have made one group, then rotate it by 90 degree, then make another group, and then rotate it again to have another one, so that it becomes a cruciate shape manner, that is two halves crossing each other's in the midline. And once four sides sculpting is done, then you fill the chamber completely with a viscoelastic. The chamber should be tight. You can use two instruments here, but you see that you have to go on the base of that and separate it. Otherwise, it will not separate. Rather, it will compress. So I am going down, and then you put your hands in such a manner that you are not pressing the lips of the wound. Otherwise, viscoelastic will come, and then you will have to put it again and again. So direct it like this, and then separate. You can use your handpiece and your chopper or anything like in this video. You can use your instrument which is all there in the eye, using the irrigation system to form the chamber. Once you make all the four quadrants, then it becomes very easy to emulsify the nucleus. You can emulsify it one by one. And for any machine, this part is I think the very easiest part of the nucleotomy. Once you have made it, once you have divided, your job is almost 50% done. Then you can just remove the pieces one by one. And with higher end machine, you don't even go to the pieces, it will come automatically to the center of the, this is called followability actually. So this is the advantage of the bigger machine. In a stop and chop technique, you make a big deep crater on the center of the nucleus and then divide it into two parts. So this is actually a combination. This is between the four quadrant and the direct chop. It has the advantage that you can use it in all grades of nucleus again. And many of the surgeons actually prefer a stop and chop, because here you have made a groove, and then it is very easy to crack the nucleus into two pieces as opposed to the direct chop. And again, it is less time taking as compared to the four quadrants. So you see that once I am going deep into the center of the nucleus and trying to separate it. Once it is separated, then Phaco becomes very easy. Then again, you have to use the other halves have to be cut into multiple pieces to take it out. Phaco chop is this is the most efficient way of doing the nucleotomy, because it requires minimum energy, but it has got learning curve. There is less stress on the zonules and a capsular bag, and it can be horizontal or vertical. But you should be ambidextrous. Your both hands should be working very nicely, and there should be very good control of foot switch, because here what you are doing is doing under high turbulence, and basically you depend on your reflexes and not on the visibility. In the four quadrant, you are basically seeing everything and doing slowly, and here you are basically using your reflexes. Because you are keeping the things under very high vacuum, so the chances of complications are also there, and chances of the fluctuation of the anterior chamber. In horizontal chopping, you hold the center of the nucleus, then lift it little bit, go below the capsular margin to the periphery, and then pull it towards the nucleus. That will crack the nucleus into two pieces. Again, rotate it, do the same thing, and it will crack the nucleus in two pieces. The two halves then again be cracked in similar fashion in multiple pieces. For hard cataract, you can do 3 or 4 as required, and for grade 2 cataract, just doing it once or two will be sufficient. In vertical chopping, the direction of the tip and the tip and the chopper should be as opposite to each other and in vertical direction. And here you need to use a sharp chopper which should be little bigger, because you want to divide the nucleus. So this is just a small video demonstration. Again, you have to rotate the nucleus nicely. Here you have to make capsular axis little bigger for this hard cataract. For horizontal chopper, you need a little bigger capsule axis, but even in vertical chopper, even if the capsule axis is small or even small pupil, this is the best technique of disassembling the nucleus. Here I am just using the opposite forces to divide the nucleus using the sharp and bigger chopper. And once the central nucleus is divided and two halves are made, then the things are same as described earlier. So comparing all three, divide and conquer is easy to do, but requires lots of energy. Stop and chop is between the two, and I think everyone can master this. And chop technique requires little bit more of experience, but if you are a beginner, go graduating from divide and conquer to stop and chop, and then chop. Coming to the soft cataract, which is little different, which has to be managed in a little different way, because you cannot chop it because of cheese wiring effect. So here, what I do that apart from the hydrodissection, I do hydrodelineation in most of the cases, and that helps in creating a small central hard part of the little bit harder part of the nucleus, which can be just aspirated first. Then you can aspirate the other parts with the bimanual irrigation aspiration or the coaxial irrigation system. Here I am taking out the saving the central nucleus. Where is that? And once you have removed it, you can actually flip the part of the, like here, I am taking out the epinucleus, I am holding the periphery, and when I am pulling, I am using the iris spatula just to push the other part, so that it flips and then it is aspirated out. So this is chip and flip basically. And in soft cataract, you need not use chopper. Rather, iris spatula is very handy and very helpful for me. In my cases, I always use this. So that is very helpful and very safe also. So this way you can remove the soft nucleus. Another way is that you just do the hydrodissection and prolapse the nucleus in the center, in the anterior chamber, because you don't have any hardness in the nucleus, so there is no fear of hurting the endothelium. So you can just prolapse the nucleus here like in the anterior chamber, and then you can just aspirate it, phaco aspirate it. So nucleotomy is important and difficult step of phacoemulsification. It requires learning, and divide and conquer is the way to start with, and judicious interplay of parameters, chopper. Possibly you can do nucleotomy in all grades of the cataract.